Hi, I'm Demetre Daskalakis, the Assistant Commissioner for the Bureau of HIV/AIDS Prevention and Control at the New York City Department of Health and Mental Hygiene, and I am really proud to be here today supporting Bridging Access to Care and their amazing work in the fight against HIV/AIDS and part of the plan to end the epidemic of HIV/AIDS in New York by 2020. PrEP is pre-exposure prophylaxis. It's a pill that people can take once a day to prevent HIV infection. It works by blocking HIV from replicating in cells. So if someone's exposed to HIV and HIV gets into a cell, PrEP is like a stop sign. It doesn't let replication occur, and what happens then is that there is no HIV infection. So even though there's an exposure, people don't get HIV. So if you are not using condoms every time you have sex, you should think about PrEP. And the best way to find out if PrEP is really for you is to talk to someone who's a PrEP expert. That could be someone who's a doctor, a nurse, a social worker, an HIV tester or counselor, someone in that world, and just talk to them about your life. They need to know about your sex life, about your drug use, and about any condom use or lack of condom use that you may have. If you are telling them the truth about your life and really sharing that information, they're going to be able to give you really good advice as to whether you should be on PrEP or not. Any medication can have side effects, and PrEP potentially could have some as well. The bottom line is that the side effects for PrEP tend to be very mild. People, when they first start the medicine, may have headaches, may have some bloating, some fatigue, but all in all, that tends to go away in a couple of weeks. There are other things that people worry about that are longer-term complications, and that's why you go to the doctor. So you go to the doctor and you get your kidneys checked out and also a review of your medical history to make sure there's not a reason to be worried about fractures or reduced bone density. PrEP can cause kidney dysfunction and can also cause problems with bone density, but the bottom line is that they're really rare side effects, they're reversible, and that's why you're going to be connected to care to make sure that you don't have any of the early signs of those complications. So we think that PrEP and condoms go really well together. So rather than stopping or reducing condom use when you're on PrEP, you should use condoms as often as possible. We know that PrEP can prevent HIV, but it does not prevent syphilis, gonorrhea, chlamydia, or hepatitis C. So to really play sure in New York City, what you need to do is combine PrEP along with condoms. It's kind of like building a house. That's HIV prevention. You have a toolkit. To build a house, you have a hammer and you have a screwdriver. You don't abandon the screwdriver just because you have the hammer, you use both. And so that's the story with pre-exposure prophylaxis and condoms. You use everything in the HIV prevention toolkit to prevent HIV, not just one thing. So PrEP is not an emergency medicine for after sex. PrEP is something that you take every day to prevent HIV because you know that you may be at risk. If you do get exposed to HIV, if you have something that happens, the day after, you can go on post-exposure prophylaxis. That's a better strategy. So PrEP's not for post, it's for pre. That's why it's called pre-exposure prophylaxis. It's prepared for HIV exposure rather than reacting to it. People who don't use condoms every time they have sex are candidates for PrEP. So that's really who should be using it. Would it be possible that they potentially use condoms less often? It is possible. But the bottom line is if they're not using a condom every time for sex, they're still at risk for HIV. So though there may be a decrease in condom use that we see in the real world, bottom line is that with PrEP, they won't get HIV. Now, does that mean stop using condoms? No, it means use condoms as often as possible. Every time you use a condom, that's a chance to prevent a sexually transmitted infection. And on that note, when I think about PrEP, I actually think of it as a great opportunity for sexual health. People who are on PrEP are getting screened for STIs way more frequently than ever before. In fact, when I think about PrEP, I realize that people who are on the meds are actually getting appropriate sexual health care for the first time sometimes in their lives. They're getting screened for STDs every 3 to 6 months, and by doing so, we're detecting infections earlier, treating them more aggressively, and I think that PrEP is going to really change the horizon of sexual health in New York City, especially for some people who haven't really tended to that piece of their lives very well. If you've been exposed to HIV over the weekend, it's an emergency. The best thing to do is to get to an urgent care, emergency room, or your own private doctor or personal doctor, and you tell them exactly what happened. So tell them the story, and then they can start you on post-exposure prophylaxis, or PEP. PEP is what you do after the exposure. That's a medicine you start right away, and you continue on it for 28 days. And if you do that, you don't get HIV. But there's another really important thing to remember. Once you're done with PEP, talk to your doctor or other healthcare provider about PrEP. you may be a candidate to go on pre-exposure prophylaxis, and that gives you a completely different security plan for HIV. It's something that you can take every day, so it's never an emergency. You're always covered.